Good morning and welcome to the 2021 Employers Health Annual Meeting. I'm Chris Goff, CEO and General Counsel. Thank you for joining us today. Before we get started with the business portion of today's meeting, I do want to cover a few housekeeping items. First, all attendees are currently in listen-only mode. Please send any questions for today's presenters using the Q&A function in your control panel to the right of the screen. As a reminder, any questions submitted are only visible by the presenters. Today's meeting will be recorded and shared on the resource page of our website. Also, there is a handout section in your control panel where you can download a copy of today's presentation. And finally, upon exiting the webinar, we'd like to hear your feedback. There will be a survey that will launch, and we certainly appreciate all of your feedback in order to design future educational opportunities. At this time, I want to call the meeting to order and proceed with the business portion of our annual meeting. A slate of 3 individuals nominated to serve 2-year terms on the Employers Health Coalition and Employers Health Purchasing Corporation boards of directors, as recommended by the organization's nominating committees, are Guy Petra from Dover Chemical, Tina Spiker with First Energy Corporation, and Mark Sponseller from Alfred Nichols Bakery. Voting is open to all Employers Health employer members. To vote on the slate of directors, click yes or no. If you are not an employer member, please select do it later. We do have a yes vote, and additionally, 57% of the votes were proxied to me, and I have voted affirmatively on behalf of those Employers Health members. So thank you all who either voted live or voted via proxy. Later today, Mike Stull will moderate the Q&A portion of today's presentation, so please be sure to submit your questions using the Q&A function in your control panel. After the presentation, Mike will announce the winner of the 2021 Excellence in Benefits Award, followed by an Employers Health update. Now for today's presentation and today's speakers. Nathan Scavello and Rashida Kula-Rumon both join us from PricewaterhouseCoopers. Nathan serves as Director of Workforce Transformation, where he has worked for nearly 10 years. Prior to joining PwC, Nathan worked in health and welfare consulting roles in various companies. Rashida is Managing Director at Strategy and part of the PwC network. She is a healthcare strategist with a track record of developing growth and managing client relationships. So I want to give a warm welcome to Nathan and Rashida as they present Forces Driving Benefit Costs in 2022.
Terrific. Thank you very much, Chris. Really appreciate the intro there. Thanks to all of you for having us on today. Just so you know, we're going to run through quite a bit of information. Actually, it's pretty dense as far as the slides go. We are going to try to leave room at the end for Q&A. But just so you know, there are links included at the end of this presentation, which I believe you all have either received or will receive. And so you can get a bit more detail there, and you can also shoot us questions after the presentation. So with that, just a little bit more about the report that we're presenting to you today. Behind the Numbers 2022, as well as the research that went into it. So each year, PwC's Health Research Institute, or HRI, projects growth of employer medical costs in the coming calendar year. As all of you know, that's referred to as medical trend. We also identify leading drivers and dampeners of that trend, referred to as inflators and deflators. This year's report is actually the 16th annual report in this series. In terms of the research itself, there are three main inputs to this. The first, and let me just advance this slide. The first is interviews with healthcare executives. HRI conducted 31 interviews between February and May of this year. That executive group includes actuaries for big health plans, covering roughly 90 million in employer-sponsored lives, as well as executives from employer coalitions. The second input is HRI's proprietary survey data. So there are 3 consumer surveys conducted in 2020 of over 15,000 consumers, 1 health executive survey conducted in the fall with over 400 executives, and that spans payers, providers, as well as pharma life science companies, and also a clinician survey conducted in March and April of this year of over 1,300 clinicians. And last but not least, we actually have our own analysis of government data sources, journal articles, and other publicly available information. So that's a bit of the background there on that. Moving on, HRI is projecting basically a 6.5% trend for 2022. So taking into account the pandemic-rooted inflators and deflators of costs, that 6.5% trend is what we're finding for 2022. This is slightly lower than the projected medical trend for 21, which was about 7%. A little bit of detail on that in a minute. But it's also slightly higher than it was from 2016 through 2020. To determine that 6.5% trend for next year, we talked to a number of health plans across the country from February through May of this year to really get a sense of how employer costs will change for next year and impact the trend, as well as impact their premium setting for the following year. Just that note on 2021 trend, when we talked with the health plans, we actually asked them what they used for 21 premiums in 2020. Based on those conversations, we revised our medical cost trend last year from a broad range. You know, no one kind of knew what was happening last year, so it was somewhere between 4 and 10% originally projected, and we homed that in to 7% based on those conversations. Now, there are a couple nuances with regard to the trend worth discussing. Mainly, there's a range of methods that are being used by both health plans and self-insured employers, and we found that the self-insured employers are following something similar to what health plans are doing. So the health plans typically start with historical claims data. The data they're put into their models to determine trend and ultimately to set premiums. What most of these large plans are doing are actually removing the COVID-19 driven impacts from their baseline claims and trends. So basically, it looks like the pandemic did not happen. Using this adjusted baseline, they then apply normal trend on the assumption that spending will return to normal levels that would have been expected in 2022, as though there hadn't been a pandemic. Then from there, they're adjusting their normal trend for next year to reflect expected impacts of the pandemic on spending for that next year. Things like additional testing, treatment for various waves, vaccine costs, worsening population health, as well as positive and negative behavior changes on behalf of patients seen during the pandemic that could in fact outlast it. The self-insured employers generally are taking a similar approach, adjusting historical claims experience to take out COVID-19 driven impacts and project forward from a normalized baseline of claims. A lot of you are at this point in the year, we're kind of beyond where you would be setting rates for the following year. So probably more than a few of you have kind of tackled this as you've gone through this year. There are two kind of key issues as far as the 2022 versus the 2021 trends as far as the dip. First, the pandemic's persistent effects are expected to have a smaller but still upward impact on 2022 versus 2021. And second, this is basically, in short, there's less certainty involved. I think as things have started to normalize, you'll see less, kind of less in the way of risk corridors applied, which is why you see a slight dip for that trend number going into 2022 versus what you saw in 2021. Now, obviously, when you look at this graphic, it includes medical cost trend as though the pandemic didn't happen. We'll take a look at the next slide to see basically what 2020 and 21 and 22 might look like in light of these changes. Okay. So overall, we know that healthcare spending by employers in 2020 fell well below the 6% expected growth rate. Despite this lower than expected spending in 2020, however, the health plans and employers expect the spending in 21 and 22 to grow to levels that exceed those that would have been expected in the absence of the pandemic, as you can see in this figure here. So one of the questions that we've been asked is, so what happened to the savings from 2020 spending being lower than expected? And this is where it really varies between fully insured and self-insured plans. So on the fully insured group, the short answer is that due to MLR, or medical loss ratio requirements, which basically require health plans to spend at least 85% of the premiums on healthcare costs, including medical care, prescription drugs, et cetera, or provide a rebate. We saw that many of them obviously did not meet this threshold, and so a few things happened. One is they've rebated those portions of premiums starting this year in 2021. Some of them actually proactively started to pass along the benefits of that in 2020, and this varies from carrier to carrier. And then obviously there are some who, in accordance with their contract with a specific employer, may be refunding the employer retroactively based on healthcare spending in 2020, or reducing future premium rate increases based on 2020 spending. That would reduce the premium rate change, but not necessarily affect the medical cost trend in future years. For self-insured plans, they're under a separate set of rules, right? So under ERISA, there are no MLR requirements. And so there have been a variety of things that we've seen employers do who were self-funded with regard to those savings. Some of them we've seen actually invest in programs related to health and well-being, which I'm sure a lot of you may have done or have seen as well. Things like expanding virtual options to include weight management and disease management programs, expanding mental health services, including free mental health visits through EAPs and other programs, or expanding or even creating. There was a huge rush on kind of figuring out the caregiving options on a go-forward basis where employers invest in. So that's a quick rundown of the kind of the trend and what we've seen. I'll turn it over to Rashida now to walk us through some of the inflators that we're seeing.
Thank you, Nathan. So now that we have a good sense for where we believe the trend is going to land, we're going to shift gears and talk a little bit about the driving forces behind the trend itself. And when we did the report, HRI, which is our Health Research Institute, identified 3 inflators and 2 deflators. So inflators that push the trend upward and add to medical costs, and deflators being things that are being put in place that have a downward impact on medical cost trend for 2022, which are the highlight of our report. So you can see there are three inflators and 2 deflators here, but going to the first inflator itself, which is probably one of the biggest inflators that we have, which is the overall sort of increase in spending due to deferred care during the pandemic. So when you think about what happened with the pandemic, right, a lot of folks were sort of afraid to walk into the hospital. There were sort of issues within the system itself where people were not able to get appointments, and created a lot of deferred care in the system. We do expect some of the deferred care coming back in 2022, which is going to have an upward impact on trend. There are three areas that we focused on to understand how much and what kind of deferred care will come back in 2022. The first one was just, there is foregone care that is actually not going to come back, which has a downward impact on medical cost trend. This is, annual screenings, prevention, your wellness visit, any surgeries that were less invasive, that, over the course of time, sort of things took care of themselves, and those are things that are not going to come back and continue to have a downward impact on medical cost. There is a second category, which is deferred care that will come back in the same form. So think about like knee surgeries, hip surgeries, sinus surgeries, things that members were sitting on, the system did not have the capacity to address those surgeries or care issues in 2020, 2021. We do think those will come back. So these are like your non-emergent procedures that will have an upward impact, a little bit more than the annual run rate that we see, just because those that would generally have in 2022 are going to have them. Those that deferred in 2020, 2021 will also have them. So we see that as an overall upward impact. The third category, which is deferred, that now requires more intervention. So this is basically coming back with a vengeance, things that could have been caught in stage 1, so stage 1 of cancer, pre-diabetes, that should the screenings have happened in 2020, 2021, they would have been caught early on, having a lower cost of care or burden and maintained and reversed in certain cases. But now these conditions have sort of deteriorated, and hence the members who are going to now identify those cases will be in a worse position. So we think that is the piece that has sort of the highest negative trend on medical cost in 2020. In 2022. Then moving to the next slide, another.
Sorry, Rashida, that's my fault. There you go.
Right. Sort of another thing is population health having worsened during the pandemic. So another factor that could have a higher sort of spending via acuity or higher acuity in 2022, that is due to worsened population health. We surveyed a lot of providers as well as nurses on what patients are reporting in terms of their health behaviors, and found significant increases as expected in isolation, loneliness, depression, anxiety, and even burnout, because a lot of the folks who've held jobs have been stuck in front of their screens. A lot of the people were in transitions between job have had difficulty finding new jobs. So all of those things added up. What we saw was a reported increase among patients in use of alcohol, poor nutrition, lack of exercise, higher smoking rates, and all of these would have sort of a notable increase in medical cost trend. So this goes into sort of an inflator as well of medical cost trend. Another inflator that we saw was the health system has prepared for the next pandemic. So this is more sort of the capacity that the system has created after dealing with the first pandemic. And so as we see the ripple effects and the waves of the pandemic coming in, new variants, other things, the system has a better ability to manage the impact, but also with that continue to deliver care at higher rates than they were able to deliver in 2021 and 2020. So with that, like looking at the system itself, the supply chain issues and disruptions have been managed. Investments have been made into better ability to forecast some of those supply chain disruptions. Investments that are planned by provider executives in predictive modeling, more scenario planning, simulations, and other things to be able to manage this impact. So all of that to say that, when you think about 2020, 2021, the hospital industry went on a standstill and really just took care of COVID patients. Now, with better supply chain and better analytical capabilities, they should be able to deliver higher volume of care, which is another inflator to medical cost trend. We saw providers spending more on staffing and safety measures as well. So when you think about infection rates amongst physicians that happened in 2020, 2021, we do think, like PPE, restoring trust, better ability in managing trust of their employee population. All of those things have had an upward impact. 51% of the clinicians also said they were changing their workflows to limit patient exposure. So just like the workflow that happens on the hospital floor itself, there have been significant improvement in those and managing those within hospitals. So all of those as well would have an upward impact on medical cost trend. Going to the last slide, the system has also addressed health disparities that were highlighted during the pandemic. So really access issues when you think about how and where the population gets their healthcare. So, the Black, Latino population suffered disproportionately during the pandemic. A higher proportion of cases, higher hospitalizations, outsized financial flows, and then that population also received fewer vaccinations as compared to white Americans. Health organizations are making investments to address historical and persistent health disparities that were made more pronounced and visible during the pandemic. These investments will likely dampen healthcare spendings in the long run, but will drive higher price increase and higher utilization in the short term, being 2022. Not every action to address racial health disparities has to be a significant investment. Understanding consumer preferences, how they vary by race, how to help providers, pharma life science companies, payers, and employers address these disparities goes a long ways. So, for example, just understanding how the preferred site of vaccination for a COVID-19 vaccine varies across races helps providers, payers, and employers reach populations that were lagging otherwise in COVID-19 vaccination rates, and could sort of inform some of the strategies on, booster shots, annual flu clinics, and other things. So providers generally have been leaders in the industry when it comes to investing and addressing racial disparities, but some of those things that were a little bit in the blind side in 2020, 2021 are starting to be more addressed this year and much more next year. So we are seeing some of those investments that will help create more sort of efficiencies in the system and hence have a higher cost impact on medical cost and upward sort of inflator impact there. Nate, I will turn it back to you.
Yeah, so basically, it's an interesting role that the employers have to play here. There was a a business group on health survey done in the spring that showed 78% of large employers were prioritizing equity, diversity, and inclusion as part of their health and well-being strategy. And about 56% of those are actually working to identify health inequities within their benefits scheme, benefits or care delivery scheme. Employers, and especially those in large cities, are also beginning to pay special attention to things like provider proximity and equity related to geography and neighborhood coverage. As they identify these disparities, they are beginning to work with payers a bit more robustly to try to find some solutions for those as well. Great. So we'll move on here. Our last inflator, the pandemic has accelerated providers' improvements in digital experiences so that they can both maintain their relationship with patients as well as reach new patients. Providers have been fine-tuning their digital front door, if you will, the mobile apps that connect them to their patients, both enhancing patient portals as well as leaning much more heavily on customer relationship management or CRM tools more than ever before. They're actually using virtual care not only to improve that patient experience and connect more regularly with patients, but also really to expand their capacity and avoid some of those frustrating or alienating experiences for patients. HRI expects these investments will expand consumer access to care, increasing utilization and, in the end, cost trend for 2022. Oops, sorry here. The health systems are also really looking to use digital tools to build stronger and also more continuous relationships with their patients that support growth. Investments in virtual care, analytics, and those CRM tools aforementioned can all help build better relationships that actually help drive growth for these health systems. There is an example in Garfield Health Center, which is located in Monterey Park, California. Interestingly, they had roughly a 15 to 20% no-show rate for in-person visits before the pandemic. But when they rolled out a telehealth solution, it actually dramatically reduced that no-show rate to less than 5%. The virtual option they found really helped alleviate some of the issues like childcare and transportation. And in the spirit of kind of addressing some of the inequities that we just mentioned, it was a particular boon for lower income patients who tended to have a disproportionately high number of no-shows for their office appointments. Another example of how they're using these digital tools is actually in predictive analytics. So what they're doing is they're using these analytics to basically take a look at the patients who cancel and determine how likely it is for that patient to reschedule or simply to abandon the visit entirely based on historical patterns. And then depending on the ones that they identify, if it looks like there's a high abandonment rate there, what they're doing is they're outreaching either in person or sometimes in an automated fashion in order to get that person into the care center. So a few kind of interesting ways that they're solving this. Now, one of the things with this is none of these problems that providers are looking to solve are necessarily new. They all existed before the pandemic. But a lot of these things were just kind of brought to the fore by the pandemic itself. What we're finding is that the right digital tools can also help clinicians bring the patient's care journey together. That's been an issue that's constantly been a problem and frankly will probably continue going forward, but it's getting a lot more attention now. So in a survey that we've done that HRI did earlier this year, about 58% of providers and nurses said they wanted more personal health tools like apps to actually help them coordinate patient care. Before the pandemic, provider leaders in particular were having, they were having discussions about these digital investments, but a lot of times they got tabled in lieu of other needs. The pandemic itself, we found, really kind of exposed them to how vulnerable they were without the right kind of virtual and digital tools. And so we're seeing them now take a much more serious look at coordinating care and kind of investing in those as they go forward. So even though these investments might be costly in the short term, we are expecting, and therefore, basically drive as an inflator, they should pay off in the long run over time. All right. So moving on to deflators here. Employers and payers have really been nudging people toward lower cost sites of care over the past few years. I can't imagine there's anyone on this call who hasn't tried in some way, shape, or form to get people more and more to use urgent care facilities or other lower cost mechanisms than the ER emergency room. Obviously, you've probably taken initiatives such as care advocacy programs, benefit network design, and also lower copays. Throughout the pandemic, millions of consumers became much more familiar with receiving care in some of those lower cost and frankly more convenient ways. HRI is expecting these shifts in consumer behavior to continue to reduce healthcare spend into 2022. So just taking a look at this slide here, the consumers increasingly embraced care outside of the doctor's office and hospital during the pandemic, right? We kind of saw that, a lot of us saw that, and it was reflected in our costs coming down, particularly in 2020. Some of that care was obviously at lower cost mediums in a doctor's office or a hospital. Willingness of the consumers with employer-based coverage to use lower cost sites again was fairly high. So not just see.
Hey Nathan, we're having a hard time hearing you. You're breaking up.
Oh, I'm sorry. Hold on just a sec. Let me I'll cut my camera real quick. Is that better? Can you hear me better now?
I can hear you, Nathan. Can you all hear me?
I can hear you, Rashida.
Okay. That is strange. I can hear Nathan really well. So, Nathan, are you there? He may be just.
Okay, well let's there was a question, Rashida, if you're all right, that I think dealt with one of your slides. So while we wait for Nathan to get back, let's maybe address one of these questions. So the question that came in was, were any of the supply, so when we talked about the personal protection equipment and some of the other supplies and the doctor's views on their employers, were any of the supplies required by the providers reimbursable through the government granting?
Yes, they were during the pandemic year. I don't know how long the grants last. That is something I can we will have to check with the policy group, but they have been reimbursable by the federal government, yes.
Okay, very good.
Am I back, folks? Sorry, can you hear me now?
You're back, and it seems we had some people who weren't able to hear you and some people who were, so.
Oh, interesting. Yeah, I was going to say, I don't know if it was an internet issue on my end. It seemed like a platform issue, but that's all right. We're back.
Yeah, we got it straightened out, and we got a question in while you were away. So
terrific. Yeah, I could hear you guys the whole time. I just obviously you weren't hearing me. So
excellent.
No
well,
problem.
Please do continue.
Okay, terrific.
We do have one more question. Happy to take it now or take it later.
Go ahead.
I see one more question. We just addressed the first one. The second one I see is, are there unique ways that providers are focusing on issues that may be driving costs like poor nutrition, alcohol use, increased smoking? The one thing that comes to mind immediately is that increased focus on mental and behavioral health during the pandemic. When we think about population health from a payer or a provider's perspective, we think a lot of the sort of physical health issues are related to more the mental and the behavioral. So the pandemic really put mental health on top of sort of the list of focus for payers, providers, and employers, and addressing those issues from behaviors perspective. Why do folks behave the way they behave? Why do folks eat the way they eat? So instead of addressing, sort of obesity issues or weight management challenges, bringing in a blend through therapy, counseling, medication, really addressing some of those behavioral health issues. Studies have proved that they have a much higher impact on the physical health of the member when you address those behavioral issues. So we are seeing a lot of investments around, things related to adding in counseling, therapies, other things within the care team for a member that is either provided by a payer or a provider to address these issues head on. We're also seeing employers make a lot of investments into these issues as well to reduce barriers in access to mental and behavioral health to address these issues. So hopefully that helps. Nathan, anything to add?
No, I think that covers it really nicely, Rashida. Thank you so much. So maybe we'll just kind of cover the last bit of this slide here and just a few stats for you guys with regard to folks kind of sticking with the, sorry, Kat's here to join me, kind of sticking with the virtual care. More than 50% of folks using video virtual care so that they would be willing to continue with that on a go-forward basis. And they're roughly 75% using an in-home clinician visit, urgent care visit, or retail visit during the pandemic that said they'd be willing to do that again. So obviously, if folks are willing to stick with that, it can pay dividends as we kind of go down the line and continue to see savings as far as those deflators go. This I love the title of this one. The emergency department finally becomes the last resort, right? So according to the CDC, the volumes decreased during the pandemic by about 42% during March and April of last year. Even at the beginning of this year, the volumes were down by about 25%. That's below 25% of pre-pandemic levels. So with this decrease in the emergency department or ED utilization, we're hoping to see that continue to go forward. We're kind of expecting that and bend the cost curve for employers and payers. I don't know that it's going to be quite as prolific as we hoped while we're going through the pandemic. I think that from my personal perspective and kind of things that we've seen with clients, it hasn't necessarily stuck to the extent that we thought it might. But just by way of a statistic, we had when we analyzed the medical expenditure panel survey data that we have access to, employers spent about $28 billion on ED care in 2018. And research shows us that about 30% of those visits are non-emergencies that account for about 30% of all employer ED spending. So knowing this and kind of extrapolating it, we estimate that a 10% decrease in that non-emergent ED visits or that care could actually save employers roughly $900 million in gross spending, which translates into about a point off annual trend for payers and employers going forward. So just kind of some interesting perspective on that. Over to you, Rashida.
Great. So I'll talk about the last deflator here, which is health systems finding ways to produce and provide more healthcare for less. This will really talk about the new ways of working forced by the pandemic, including remote workforces, process automation, cloud technology, that can help providers lower their cost structure in response to pressures on pricing, including the new price transparency regulations and the growing interest in narrow networks. HRI does expect that this will dampen price increases and hence spending in 2022. So what this means is the health systems can reduce costs through new ways of working. In March of 2020, employees across the globe were sent home to work from home. Healthcare was no exception, with a number of administrative and even clinical employees being allowed or asked to work from home. The pandemic has organizations rethinking how their administrative staff work on a permanent basis, with organizations considering permanent work from home policies, downsizing administrative space, and even automation and outsourcing. Healthcare providers are challenged with managing two different types of workers: the administrative employees, who generally can work from home more easily, and then the clinical workers who generally cannot work from home as easily. We have seen and expect to see bigger changes in how and where administrative employees work. For example, UW Medicine in Seattle terminated two real estate leases when they shifted their IT department to remote work environment, saving roughly about $150,000 per month. Kaiser Permanente, another example, canceled 900 million project to build a new headquarters in California and plans to repurpose existing space. The changes can actually help healthcare providers reduce costs, allowing them to respond to price pressures from employers, payers, and other factors like price transparency. So, like this is the one which, due to remote work, due to other investments, we actually do see improvements in price and expect improvements in price in 2022. Another one is health systems can increase efficiency through process automation, cloud technology. Technology-based efficiencies, including process automation, cloud services, are also being adopted by providers to reduce costs and, in some cases, boost revenues even. The share of provider executives saying they plan to invest in automating administrative functions increased from 2019 to 2022, going from 47% to 71%. Here's an example about it, right? So Moffitt Cancer Center, headquartered in Tampa, Florida, implemented robotic process automation in its revenue cycle department and reduced monthly labor by about 27,000 lives, which translates into 500,000 in savings. So beyond that financial component itself, process automation, cloud technologies, AI can make clinicians' lives easier and their jobs more fulfilling. We know there is a lot of burnout amongst providers. So some of these technologies will reduce the administrative burden and create job satisfaction for clinicians. This already exists in radiology, but is rapidly, sort of expanding in other areas of care. So that itself will also have sort of a downward impact.
Terrific. Thanks, Rashida. So last but not least, just a few other things to watch for in 2022. So besides the inflators and deflators we've discussed, there are obviously myriad things that are impacting costs overall. Some of the things that we think are obviously worth mentioning that are probably on a lot of folks' radar screens already. One is drug spending. That's a consistent driver of medical cost trend. Obviously, the pipeline of costly cell and gene therapies is only expected to increase, with some hope for biosimilars in coming years. So again, be on the lookout for that as far as a driver. Cybersecurity is also a very hot topic, especially in an industry with so much confidential information. We've seen some of this play out in the headlines, but the costs associated with data breaches and ransomware attacks can really be material and frankly hindering on an organization's ability to operate. So determining how much to invest in mitigating this threat is not necessarily simple, and something that we will continue to watch. And then last but not least, there's the an intra-industry squabble between payers and providers that often left consumers with unexpected medical bills, we think has largely been addressed or put to rest with the No Surprises Act, which takes effect next year. However, the implications for employer healthcare spending are a bit uncertain, and we'll be watching this to see how it plays out. So with that, we will turn it over, Mike, to you for any Q&A that may be outstanding.
Yeah, thank you, Nathan and Rashida. So a couple questions that we do have here. Looks like we have about 10 or so minutes for questions. So again, if you do have questions, please submit those via the Q&A function in your on your portal here. So the question that I have here, have you heard any concerns around offering services across the various sites of care? And you had a slide in there around utilization of the ER finally coming down as a result of some of the issues created by the pandemic. But then in the diversity slide, you showed that, like, for example, those communities of Latin descent may prefer to get certain services at an urgent or standalone ER. So I'm curious if you've heard any concern around being able to address the disparities among different ethnicity groups, but also the wide variation in cost that occurs between those different sites of care. Obviously very different for a standalone ER versus getting your vaccine at the local pharmacy.
Yeah. So I think that, there's a few parts to that, right? One is the question on the kind of the disparities and preference for usage, right? And I think that is part and parcel of what a lot of employers and even health plans are looking to address with regard to their diversity and inclusion initiatives, is making sure that they're kind of getting folks care in the right place at the right time. I think that will be an ongoing challenge as you look at specific cohorts within any population. So we expect that people will still be kind of homing in on those specific preferences, even as it relates to different groups within their populations. The cost disparity is an interesting one. One of the things that we've kind of been encouraging employers in particular to be on the lookout for as they look back at 2020 and even the spend going forward, is that they're not getting incorrectly charged by the plans for example, a not so much telemedicine, but a virtual care visit as opposed to an in-person visit. You know, those should be coded differently. They should be coming through obviously less expensive from the virtual care perspective. And we do expect that there will be some renegotiation that takes place if virtual care sticks and kind of continues to take off. We may see some negotiation between providers and the plans in order to get those virtual care rates up, because the providers overall will have to make up for that lost revenue somehow. So at least retrospectively, encourage employers to be on the lookout. You can do claims assessments, et cetera, to kind of make sure the claims are paid correctly. But then be on the lookout proactively for those renegotiations to take place.
And this question seems to get at the kind of the longer term viewpoint. Is there any worry that, you know, while more cost effective, the telehealth or video virtual care visits miss additional or more concerning underlying conditions?
Yeah. Good, Rashida, you want to take a crack at that one?
Yeah, I was going to say, so like, I think there is a shift that we are seeing in the virtual care models, and you will see a lot of this in headlines in the last few months, that models that payers have come out with. Historically, there was no PCP in a virtual care environment. It was care that was episodic, somewhat emergent, and you have an issue, but it does not require you driving to the ER or the urgent clinic. So let me just show it on a camera or on a call to any physician that's available right now. when you think about what some of the larger plans have released in the last couple of quarters, CVS came out with its virtual primary care. United did the same thing. We see a shift in the industry where there is primary care being provided virtually. So essentially, like you don't see a random physician, you actually have a primary care physician that you would build a relationship over the years, over consultations, over a period of time, who would also have access to all your historical information. So putting some of those models in place, we do see and think that there will be an evolution in how much care is delivered, how that relationship between the consumer and the virtual primary care physician will evolve. And when you couple that with historic claims data that now this physician will have access to, which otherwise a random sort of telemedicine physician did not have access to, I think with those structures in place, we do think the care will be equal, if not more or better than, in-person care.
Then kind of a final question I had as I was listening to your presentation. So when you think about the folks that are using these digital tools, is it new patients, or is it typically patients that were already seeking care from their physicians?
I don't know that necessarily came out in the data, Mike, to tell you the truth. I'm not sure that we asked specifically whether it was kind of new or existing patients, but I think with the kind of the proliferation of these digital tools and the wide range accepted usage of it, whether they are new or existing, we're kind of expecting it to continue to snowball in itself and hopefully drive folks who have been avoiding things like preventive care visits, to Rashida's point, to get in there, see the physicians, in particular if it's, obviously it's more convenient, but again, if they don't have a history of doing so for a variety of reasons, and this is where some of the diversity and inclusion and kind of some of the socioeconomics come into play, it can make it that much easier for someone who has transportation issues, someone who has caregiving issues, to make an appointment and either get themselves or someone for whom they're giving care into a facility virtually, virtually.
Yeah. And just to add to like what Nathan said, towards the end of 2020, we did a survey in the market to really like hone into who, how, and why are they using virtual care. And one of the things that was fascinating that I saw was that the study said 40 to 60% of the virtual care visits were by consumers who've never used virtual care before. So hopefully that answers, Mike, some of your questions, right? Because not only was there a lot more newer population that was using virtual care, but a follow-up question, if I remember correctly, asked them, would they continue to use virtual care even if their physician's offices reopened? And 2/3 of the population said they would continue to use virtual care because of the convenience that it offers. So there is a lot of hope out there for virtual care models in terms of like just newer population that is becoming comfortable and would continue to use those models.
Great, thank you. There were a couple questions about cell and gene therapies, and the last one that we got in, cell and gene therapies will be a driver of medical spend. Are there any models out there that predict the medical spend offset that these drugs should create? So not only what's the upfront costs look like, or the chance of having one of those upfront costs, but then what's the downstream effect?
Yeah, I'm sure that they exist. I don't know of any off the top, Rashida. I don't know if you've seen anything or if we've done kind of any surveys specific to that. I think that the expectation is the horizon on there might be far enough out that folks may not be, I'm sure someone's looking at it, but maybe not immediately as it pertains to some of these short to medium term cost driving discussions that we're having. But certainly over the long term, one would hope, right, that you're going to see some positive ROI, especially because we do expect them to be inflators in the short to medium term.
Yeah, I would just say that I know ICER as an organization, has done some work on fair prices, and so that's one place that we can look. I'd say the other one, MIT has an organization as part of its institution that does some work on biotech and some of these high cost gene therapies. So we can get a link to those two sites out to the questioner. One of the other questions that I had was, what about administrative cost of plans? So we see a lot of different state legislation, a lot of federal regulations that have gone through the regulatory process, and employers are trying to figure out how are we going to comply with this. Even if the Biden administration's vaccine mandate gets pushed through the court systems, then obviously there could be a lot more testing and other things that need to be done on behalf of employers. So just curious your thoughts on the impact of administrative costs.
Yeah, the carriers have not been shy so far about pushing those costs out to employers. We've already seen pretty much all of the big four saying that they're going to flip some of the costs of the additional reporting, et cetera, that they have to do starting next year or later this year to employers. So I would expect, particularly for self-insured, well, actually for all plans, whether fully or self-insured, fully insured, they'll continue to bake those costs in as they normally would. But even for self-insured clients, you're going to see the carriers pass those through. They're certainly not eating them. And like I said, they've not been shy about pushing them and kind of flipping them out to employers like the folks on the phone.
Well, I think we hit all of the questions that had come in, unless I missed some that you all see.
Someone asked if we were predicting another pandemic. The answer is no. We said again, it was probably probably just mean some of the tail end or any minor recurrences that we see. I think this is evolving, obviously, but yeah, we don't have that crystal ball by any means.
I think what we learned from this last go around was we need to be better prepared, and so I know that you had some slides in there about organizations, both from a healthcare perspective and also from an employer perspective, have to be better prepared when something like this comes again. So,
yeah.
Well, very good. Thank you to both of you for sharing this information with us today. It's like you said, I think before we even came live, you said there's a lot of information in here, and I'm sure as people go through it, they'll digest it some more, compare it to their own results and what they're budgeting for, and have some additional thoughts. So we have included a link to the Health Research Institute's Behind the Numbers report, and it's located in the chat section of your control panel for those that want to dig in a little deeper. So again, thank you, Nathan. Thank you, Rashida.
Absolutely.
Thank you. Cheers.
Yep.
So again, for those who don't know me, I'm Mike Stull. I'm the Chief Strategy Officer here at Employers Health, and I have the honor of presenting now the 2021 Excellence in Benefits Award. And the Excellence in Benefits Award is now in its 5th year and recognizes individuals within our client base for their outstanding work in improving the quality, accessibility, and cost of healthcare benefits for their colleagues and their organizations as a whole. Individuals are nominated by their peers, and applications are reviewed by an independent panel of judges to determine the winner. And so thank you to the numerous applications that came in. This was by far the year that we had the most applications. So thank you. There were a lot of very worthy applicants, and keep those coming in future years. But it's my privilege to announce that this year's winner is Chris Vanetta, Manager of Human Resources and Global Benefits at the Timken Company. a global manufacturer of bearings and power transmission products. And to say Chris wears many hats is an understatement. He's been with Timken for more than 15 years. Additionally, he has served our country through the U.S. Air Force and now is a judge's advocate for the U.S. Air Force Reserve. On top of that, Chris is a dedicated husband and a father to his 5 children, and I hear even a part-time YouTube sensation at different times of the year. So keeps him busy. I've worked with Chris for many years, and I'm honored to present this award to him. And before you hear from his colleagues, I want to provide just a few of the highlights that were submitted on Chris's behalf. Chris, first and foremost, is not afraid to question the norm and look for new solutions to the problems faced by today's benefits professionals. And he certainly embraces addressing these problems head on with a focus on overall employee health. Chris has been instrumental in the development of the organization's on-site workout facility and numerous health and wellness offerings addressing weight loss, diabetes reversal, work-life balance, mental health, and more. He continuously pushes for innovation to improve population health because he recognizes that a healthy employee is more reliable, more efficient, and happier than an unhealthy employee. He understands that a team is only as strong as its weakest link and uses that as motivation. Chris, along with his team at Timken, promote the value of understanding the plan and being an intelligent consumer through price check tools, understanding cost differences amongst different sites of care, and utilizing health savings accounts with, quote, smart savings strategies. The company offers a $750 annual Better Health discount on medical access fees for associates who meet the program's wellness requirements. These offerings truly show how invested the organization, Chris and his team are in the larger continuum of health and wellness. Should I keep going? I could, but enough of me talking. Let's hear from Chris's colleagues. I hope you enjoy this video we've put together.
I'm Hansel Patel. I'm the Vice President, General Counsel, and Secretary for the Timken Company.
Brandon Speck, Manager, Benefits Strategy and Design, the Timken Company.
Travis Johns, Vice President of Client Solutions at Employers Health.
Hi, I'm Julie Yunkin. I'm a clinical advisor with CVS Health.
My name is Christian Moreno, and I'm a Senior Vice President with Lockton Dunning Benefits in Dallas, Texas.
The quality that I admire most about Chris, working with him over the past several years, is absolutely his ability to think outside the box. As a pharmacist, I'm very much in a pharmacy box, but when I meet with Chris, he challenges me and expands my thinking to think about not only how the pharmacy programs and data are affecting the pharmacy spend, but also the overall health and wellness of his population.
He's focused on how to improve our employees' health, their lifestyles overall. It's not just about, cost benefit from a plan perspective or compliance. He really truly believes that, getting people healthy, improving their diets, improving their nutrition, getting them to exercise more, just has an amazing benefit when it comes to overall health. And he also understands that, the healthier our workforce, the more well-rounded they are, the better it is for not only the company, but society as a whole.
It's not uncommon that when we meet with Chris and bring a new idea or solution forward that we already know going in, we need to take a list of pros and cons. So he's able to see what's a pro, what's a potential con or disadvantage, not just for the Timken Company, but for its associates as well.
When I think about what makes Chris Van Atta stand out as a benefits professional, stand out amongst them all, He has an unflinching focus on really the 2 or 3 large items inside of a health and welfare plan that he wants to accomplish for the betterment of the population, whether that be wellness, more specifically population health. Over the now 7 or 8 years I've known him, he's been tireless in focusing on how to improve the member experience, but more importantly, how to give them the tools they need to improve their health.
The Timken Company over the last several years has, increasingly become more progressive in the approach to benefits and wellness. And really this has been led by Chris's direction. The Timken Company, we have implemented a lot of wellness initiatives over the last couple of years, ranging from, various weight loss programs to type 2 diabetes reversal programs, and even a very large project around the on-site fitness center at our world headquarters facility.
I know that when I walk into a pharmacy review meeting with Chris, the first question he's going to ask me is, are these therapeutic classes and drugs, can they be prevented by having employees make a lifestyle and diet and exercise change? Can they be reduced by decreasing the amount of sugar that people have in their diets? And that is just a testament of his deep concern and overall concern for the health and well-being of his members.
So Chris Van Anna's made me laugh several times, and he's probably going to be upset with me for telling this story, but we were fly fishing together in a strategy meeting, and we both fell in the water and actually went almost downriver together. And I didn't rescue him, but I think he made it out safely.
Fun fact, Chris once convinced me to be a vegan because he was so passionate about a Netflix documentary. Didn't last very long, but convinced me nonetheless. And I think that while kind of funny, I think that is a true testament to how passionate he can be about topics. And he's just as passionate about the Timken Company and its associates and managing the benefits that they have and provide.
So what makes Chris stand out from some of the other colleagues that I've worked with is his comic relief. Obviously Chris can be very serious when he needs to be, but he's always quick to come up with that analogy, usually a ridiculous analogy to compare to a benefit situation that gets a good laugh out of the room. So this always keeps us on our toes. It makes us laugh, and really it's just a different mindset every day that makes our interactions and our meetings fresh.
Chris possesses a number of qualities that I think serve as an example for people at the company. I mean, I'd say first, it's just, he's very humble, and I think that makes him a very natural leader. In fact, even when he heard about getting this, fantastic recognition, one of the first things he said was how great it was for the company and how it really was a recognition for the team. And I just think that goes a long way to showing the type of person and the character of somebody like Chris, and certainly a great example for all of us around.
Chris, congratulations on this amazing award, Excellence in Benefits. The only better outcome for me is if I had won it, but unfortunately I'm going to have to yield to you this year. Congrats.
Congratulations, Chris, on your 2021 Excellence in Benefits win. Cheers.
Congratulations on this honor, Chris. Well deserved.
Congratulations, Chris. We appreciate all that you do for us.
Chris, I want to congratulate you. I think it's a really great honor and recognition for all the hard work that you put in, as well as all of the accomplishments of your team. And I'm looking forward to what comes next.
So again, congratulations to Chris as he joins an outstanding class of prior recipients. And thank you to the team at Timken and Lockton Dunning, CVS, and our team here at Employers Health for your assistance and cooperation in putting together this video to recognize Chris's meaningful contributions. As our final order of business today, I want to spend just about 15 minutes giving you an update on our progress during 2021. We're very excited with the momentum that we have heading into 2022. There we go. Oh, went too far. All right. So each year, our work plan is guided by our RGPS, growth, performance, and satisfaction. And at a high level, we strive to grow our pharmacy benefit program by at least $200 million each year, which is roughly 10 to 15%. We know that to be successful in our growth objective, we have to help our clients hit their internal sales goals around managing pharmacy spend and trend. So our goal is to help plans reduce spend and hold trend flat to negative. And then finally, we have to ensure that our clients and their participants have an exceptional experience with our solutions. So keeping the average rating in our client satisfaction above a 4.6 on a 5.0 scale is our third primary aim. Growth is an area of great pride for our organization, and surpassing our goal of adding 200 million has been achieved in each of the past 4 selling seasons. Each new win is one where we work through a competitive RFP process conducted by an independent and objective consultant to prove that our solution is not just the most advantageous for our client at the point of the RFP, but that our structure and collaborative approach sets up the client for the best results now and into the future. You can see specifically our results for 2022 and where we expect to be on the whole. So 42 new groups this year for a total of 270 clients heading into 2022. And those clients will spend a projected $2.2 billion while providing benefits to more than 1.3 million lives. So in a marketplace where consolidation is happening all around us, from PBMs, health insurers, doctors, hospitals, brokers, consultants, it's really more important than ever for employers to work together to maintain leverage in an otherwise shrinking market. Thank you to our entire team and to our existing clients who served as references this year. Serving as a reference is a huge help to us, and you're very much appreciative. I can't say how appreciative we are in terms of having the ability to have a prospective client reach out to a peer at one of our existing clients to ask for a reference, and for our existing clients to take the call and provide positive feedback. So very much appreciate all of you who served as references this year. What started here in Canton, Ohio, continues to spread all over the country, and this heat map shows where our clients are headquarters. We have lives in all 50 states and U.S. territories, but this shows where the clients are headquarters. So you can see where pockets of clients have begun to form, and we look forward to continuing to spread across this map more into the future. If we're going to grow and continue to grow, we need to ensure we have the people and resources in place to ensure that our clients are meeting their performance goals and having that first-rate experience. Again, this year, we've made investments in additional team members on our clinical pharmacist team, our client solutions teams, analytics, and our client events team. So with the addition of 2, Courtney, Coral, Nathaniel, Catherine, Tori, and Rochelle, the total number of team members working with you is now up to 45. So 45 dedicated individuals to being resources for all of our clients. And our team is a differentiator for our organization in the marketplace. And so I would encourage you to get to know as many of our talented group as you can. And certainly, as I said, we're here to be a resource for each of you. Now to performance. So I have a slide that shows year-to-date performance on the CVS book of business through the first 3 quarters. And I'm not going to hit every number on this slide, but I'll provide you with just a few highlights. So you can see at the top there, nearly 1 million lives in our program are currently in the CVS deal today, spending nearly $1.25 billion. Our total PMPM is at $140, although about 40 of that is taken off with rebates. You can see that our trend is about half of the rate of the benchmark. And when you factor in rebates for both 20 and 2021, our trend is actually flat. So it hits that goal number 2. Our specialty PMPM is a bit above the benchmarks at $65.93, but it's again growing at about half the rate of the benchmark, as you can see in the gross trend graph at the top of the slide. In total, specialty pharmacy costs represent about 47% of total costs across our book of business. Now, this can be a deceiving metric when comparing plan to plan. Yes, your specialty plan and your specialty spend plays a role, but so does what's making up the rest of your spend. So for a group with a low incidence of conditions, say diabetes, and a high generic dispense rate, they may have the exact same PMPM spend in specialty as another group, but their percentage might be higher. So just one word of caution as you look at that metric, the percent of spend that's made up of specialty, it's also can be affected by the rest of your plan spend. So just make sure that you're focusing on where the PMPM is, or the PMPY, or the PEPM, however you like to look at it, versus the benchmark. Today, more than 40 of our clients have implemented Prudent RX on the CVS side, which maximizes the use of copay coupons available for specialty medications. And as adoption of this program continues to rise, we would expect to see our specialty per member per month costs continue to moderate. And then finally, you can see in the middle section that it's really drug mix that is pushing most of our trend. And that again points to the specialty drug piece. And so our team is out there continuing to work with you to find both sustainable and innovative strategies that we can use with our clients moving into the future. While pharmacy benefits is our focus, we do have a multitude of other solutions that are available to clients. And I'd encourage you to work with your consultants to take a look at some of these other offerings. One that I do want to talk about, and our newest offering, is with Quantum Health. So our clients recognize that one vendor, such as a big carrier, isn't providing the best solutions across the broad spectrum of health and wellness benefits offerings. Many of our clients utilize multiple vendors, taking advantage of better service, better outcomes, and better costs. But the challenge that they have is how to help their employees navigate these great benefits. So how to make it more simple, how to improve their experiences. And the solution we think you should look at is Quantum Health. Quantum is focused on helping your participants identify the care they need and find it at the most effective and efficient site of care. Even with one vendor, the healthcare system can be a very scary and very confusing place. And Quantum ensures that your participants don't have to go it alone. So if you're interested in learning more about Quantum Health and the offering through Employers Health, please do feel free to reach out to me or your Employers Health representative. Finally, let's take a look at how we perform from a client satisfaction perspective. Clearly, there's been many challenges in the past 2 years dealing with things like COVID and remote work, travel restrictions, and the like. And we're very proud of our latest client satisfaction survey results. And thank you to the 100+ individuals who completed the survey this year. I mentioned at the beginning that our goal is to attain at least an average score of 4.6. And this year's result of a 4.8 is something that we're really excited about and again take great pride in. We also asked for one word that describes the Employers Health team and are pleased that the qualities that we emphasize with our team are the same ones that come to the mind of our clients. And so you can see those here: partner, supportive, professional, diligent, knowledgeable, exceptional, dedicated, all things that we really try to drive home when we think about how we're providing value out to our clients. So we're very happy that those are the words that come to mind when we ask that question. And we're always going to strive to continue to meet these lofty expectations. We've created a lot of great content over the past year. And if you've missed our webinars, our podcasts, blog posts, or magazines, don't worry. You can find them all on our website, and you have links here. employershealthco.com is the link, and just a lot of great content there for you to take in. And I look forward to being back here next year to share with you our progress that we've achieved in collaboration with our clients, their consultants, our shared vendor partners, and in the employer's health team. So we'll continue to work to color in the map. And then my last plug, our two main conferences are returning in person next year. So our Pharmacy Benefits Conference will be held March 16th in Columbus, Ohio. And then our Innovations and Benefits Conference is slated for May 18th here in Canton. So please do mark your calendars and plan to join us. We will be recording both conferences for on-demand access, but if you're able to be here, we'd love to see you. So we do encourage you to join us in person. So with that, I thank you again for spending part of your morning with us. I hope you got a lot out of Nathan and the PwC's presentation. On behalf of our entire team here at Employers Health, we wish you a safe and healthy holiday season. Thanks again, and have a great rest of your day.